Thank you for listening to Here's to Your Health, a podcast brought to you by the Crawford County Memorial Hospital. During this podcast, we talk about healthcare, the people behind it, and the opportunities that help shape the next generation of medical professionals. This podcast is where we share stories, insights, and conversations focused on healthcare and the people who make a difference in our community. Thanks for listening to the Here's to Your Health podcast.
Do you want to just start off by kind of just talking about the differences between normal aging and memory changes, and maybe what would be some red flags to look out for?
Yes, yeah, that's great. So everybody has memory loss, and we don't usually start to get worried about it till we get older. And so normal memory loss would be occasionally forgetting a name, occasionally misplacing your keys, forgetting a password, having to think about a little longer what day it is, but you remember it once you think about a few things. Abnormal memory loss, flags that you might want to look out for, is when those things start happening on a regular basis. So they're happening daily instead of occasionally. You start to get confused during normal, familiar tasks. Things that you've done frequently start to cause you to pause and have to think about it deeper. Forgetting the year or the current month is more of a flag than forgetting what day of the week it is or the date. Forgetting how to use a common object like a calendar, having to think about that a little bit, or a calculator. You lose things on a regular basis. Having difficulties with movement or problems with your sense of smell, interestingly enough, can be another flag. So if any of those sorts of things happen on a more regular basis, you probably want to talk to your doctor about it and get it checked out.
Are those always going to be things that the person experiencing the memory loss is going to be aware of, or is that something that families can also be watching out for too? Absolutely.
Many times people will be like, oh, that's just me. I never could remember names, or, the date's not important to me anymore. I don't have to keep track of the date. I'm not at work anymore. So a lot of people will find a lot of reasons why they're having that difficulty. So definitely family members can note that, and it's often hard for them to approach it with the person, but gently just noticing those things and saying, it seems to be happening on a more regular basis, and maybe we should talk to the doctor about it, because there might be a reason other than dementia that it's happening. And I think that's what people fear, is they automatically fear it's dementia, and we fear dementia because we don't have any good treatments for that. However, if it's not always dementia. It could be imbalance, some type of imbalance in your body. It could be depression. It could be consistent alcohol use. It could be a number of different things that the doctor is able to pretty quickly rule out or be able to reverse if it's earlier on. The other advantage to finding out what the cause of your memory loss is, even if it is an early dementia, there are many more options for you to treat or delay that when we catch it in the early stages. And by early stages, we mean when you start to notice that there's a difference. And even if the quick memory test they give you at the doctor's office, remember these 3 words, or remember this person's name and address, what is the date today, who's the president, all of those things, even if you're perfectly fine with those, but you notice that there's changes going on, you can tell that your memory is getting worse. That's really when you want to tell your doctor about it and potentially look at lifestyle changes that can delay or prevent further decline. So it's important not to write it off, but rather mention it and have a few easy tests run.
Yeah, sounds good. Mm-hmm. Let's say the provider comes to the conclusion that somebody is experiencing something like Alzheimer's or dementia. Mm-hmm. What role do you play as a speech language pathologist? What can that look like in terms of treatment, coinciding with what they might expect from their PCP, anything like that?
Right. What I tend to see is if there's a concern from the person the family member or the doctor. If any of them have concerns, they may refer to speech therapy, and they're like, why speech? I can speak fine. Well, we are able to give a more comprehensive cognitive test because we have more time. It'll take a half an hour to an hour to administer that cognitive test. And it gives the doctor a lot more information to add to the test that they run to determine the potential cause and treatment options. The other thing I provide when I do that testing, and that testing compares the person to a person their same age. So it's not being compared to somebody who's a lot older or younger than you. So those test results are very helpful. I also provide general education on memory strategies that you can use to improve your memory regardless of what the cause is. Also education on dementia, so it's not so scary for the family or the person. That we talk about, if we do the actual test that potentially helps diagnose dementia, we talk about what stage of cognitive decline or memory loss that you're in, and some things you can do to help delay or prevent it. I always say, even if it is dementia, even if we do determine, the doctor determines that it's dementia, I think you need to look at it like a lifelong disease, like maybe Parkinson's or something. Everybody knows somebody with Parkinson's, and now with all the treatments that we have for Parkinson's, people live a long time with really good quality of life that have Parkinson's, where before that was a really scary diagnosis. It means I'm going to be in a wheelchair and I'm never going anywhere. That's not true anymore at all. We diagnose it early along, and they live many years with really great quality of life and family interaction. So I think we can look at dementia when we catch it early on that same way. There are things we can do. It's not an immediate horrible thing.
What you're saying is that people shouldn't be afraid to try to be proactive if they have those concerns. Try to not push it away because it could become worse if they don't seek early treatment. Is that kind of the line?
Correct. It shouldn't be so scary. Of course we all want to have our mind and our memory as long as we can. And there are things that we can do. We now know through the research there are many things we can do to prevent the decline, and it actually starts in ages 45 to 65. So even in those younger ages, there's so many things that we can do to prevent that cognitive decline, no matter what the reason for the cognitive decline is. So from age 45 to 65, you can prevent almost 40%. You can decline your risk of developing dementia by 40% if you look at these risk factors and control for those. If you have some hearing loss, go get it tested and get it corrected. If you do that, you lower your risk of dementia by 7%. And that's, again, something a lot of people put off. And you definitely don't put it off, because it can lead to worse things, or you can prevent those worse things from happening. Treating your high cholesterol, treating any depression, wearing your helmet when you ride your bike or do things that have a potential for a head injury. Being physically active, treating and preventing diabetes, stopping smoking, treating your high blood pressure. If you're having some trouble with your weight, working on that, watching your alcohol intake. All of those things are listed and are known to reduce your risk of cognitive decline as you age. But probably the most important thing is, if you have concerns, you need to mention it to your doctor so we can monitor for it. Look at it the same way as you would your heart. If you had heart palpitations, you wouldn't ignore it. You would mention it to your doctor. If you had numbness in your legs, you would not ignore it. Don't ignore your memory problems. At least mention it so it can be monitored and potentially treated.
Yeah. Since we're going this direction, what does treatment look like, for people? It probably depends on different stages, but I think that's probably part of why people are scared, is because they don't know what that looks like. Are they taking a lot of medications? Do they have to make significant lifestyle changes? What can that generally look like, or is there even a general standpoint?
The first step is always ruling out or trying to determine the cause of the cognitive decline. If you're having trouble thinking and with memory, we really want to get to the bottom of what it is. So there is some testing with that. Blood work, maybe a brain scan potentially, those kind of things that the doctor does to rule all those other issues out first. And then if it is determined that it could be dementia or is dementia, then it's really an in-depth discussion with your doctor what your options are, because there are a lot of options. There are lifestyle things that you can do. A lot of them are things you already know and you hear for every other health problem. You know, it's keep a healthy weight, exercise, eat well, sleep well. The thing that stands out to me that's different for declining cognitive skills is you want to challenge your brain. So we tell you to exercise to keep your muscles strong. You have to challenge your brain in order to keep your brain strong. So if you're just doing your daily routines, and routines are good, don't get me wrong, routines are great, and they really free up your mind to do more difficult things, but that's the key. You want to keep routines so that your mind and your energy is able to be challenged and able to do things that are more difficult. So whether that be a new hobby or planning a trip to go see family and friends, going out and socializing on a regular basis where you're engaged in conversation about political events, about religion, about topics that you can really get in depth into, whether you're part of a book club or a card club. Those things all challenge your brain. And the number one thing is that you're always learning new things. That challenges your brain and keeps your brain functioning and strong. Just like we always want to exercise our body to keep our bones and our muscles strong.
Thank you for listening to Here's to Your Health, a podcast brought to you by Crawford County Memorial Hospital. We hope today's episode provided helpful information and a better understanding of the care and services available in our community. Be sure to join us next time for another conversation on Here's to Your Health.